hand over to our guests today. So that's Dan Chalk and Sammi Rosser. Dan.
Thanks very much, Rachel. Okay, so hi everyone. My name's Dan Chalk. Let me just share my screen and put it into presentation mode. Hopefully you'll be able to see this when it pops up. Can I just check everyone can see the slide okay?
Yes, perfect.
Fantastic, brilliant, thank you. So yeah, hi, so my name is Dan Chalk. Some of you may know me. For those who don't, I'm a senior research fellow with an organisation called PenArc, which is quite complex to explain right now. We're based in the University of Exeter Medical School. I live in Cornwall, as it happens, but basically our organisation is all about bringing research into practice and doing applied health research. And our team, Penn Cord, is basically an operational research and data science team. And we've been going since the end of 2010, beginning of 2011. And I've basically been there since the start. But what I'm going to talk to you today about is the HSMA programme, an initiative that's been going on since 2016, which is quite a core, important part of the work we do now. So, there we go. So, what is the HSMA programme? Well, the HSMA programme is the Health Service Modelling Associates programme, and it's basically for staff, principally analysts, but not exclusively. Mainly we get analysts because of the nature of what we do, but it's open to anyone essentially who is working in health, social care, or even policing organisations who either have some sort of analytical role, which obviously most work in analytical type roles, or have some capacity and some interest to do some analytical type work. So we've had GPs, other clinicians, we've had service improvement managers come through the programme, and you'll hear a bit about the things they've done from Sammi later as well. So you don't have to be an analyst, you likely will be, but basically if you listen to this this talk and you think this is really interesting and I reckon I could do something with this, then the HSMA programme is probably for you. So it's a day-a-week course for 15 months. So it's quite a big commitment, but you get quite a lot back in return. So the course is split into two phases. We have the first phase, which is the training phase, which lasts for 6 months. And it's basically quite an extensive and pretty intensive training program where we teach programming in Python from first principles. We teach operational research and we teach data science methods. And I'll talk more about the stuff we teach a bit later. But really the heart of this program lies in the second phase, which is called the Inception Project. The idea is that this is a course in which we teach you lots of stuff, pretty much everything we do within the team. And then the idea is that you take some of that stuff, one or two of the methods, and you apply that immediately to a project that addresses an issue of importance for your organization. So you don't just get trained in something, you get to immediately apply that stuff and make a difference and make an impact and hopefully improve things for your organization. And you get mentoring and guidance from us and from our community, and we'll talk more about that. And you get supported to do this project. But these are your projects and they are real life projects, and they will make a real world difference and hopefully change people's lives. And it's worth flagging up at this stage, this course is entirely free of charge to participating organisations. We are funded centrally to do this, and the course is delivered entirely online. And so it doesn't matter where you are in the country, we're open to anyone in England due to our funding, and you can access it wherever you are. So I mentioned that we teach operational research and data science. Probably most of you will have some familiarity with data science, but probably fewer will have familiarity with operational research because it perhaps isn't as widely known, although it's been around for a very long time. It does have a terrible name, which doesn't really explain what it does. But basically, a good way to explain it, operational research is basically about using things like mathematical modelling, computer simulation, analytical techniques to try and help inform some decisions about some aspect of the operational management of an organization. So in our case, it's thinking about things like, where are the delays in the emergency department processes and how might we reduce them? Can I build a model of RED and see what happens if I do this? Can I build a model of my GP clinic and work out what would happen if I lost a doctor here, or if we recruited an extra receptionist? Where should I place my services? Where should I place my mobile van? All that kind of stuff. Data science is similar but slightly different. So data science basically so operational research kind of starts with the system, and data science starts with the data. And it, in particular for the HSMA course, we teach things in artificial intelligence, natural language processing, and I'll talk more about some of those things. Basically approaches that allow you to generate insights from your data. So a data science style question about an ED might be something like, can we teach a machine to predict when an emergency department is going to breach our target? So it's similar but different, and we as a team do both of these things. But the core thing that links all of this together is that everything that we do in terms of our research and everything that we teach you as part of the HSMA program is practical and applied. The idea this isn't, what this absolutely is not, is a course where you just learn stuff and then you never use it. The idea is that you learn stuff and then you immediately use it, and hopefully you go on to then build those skills on an ongoing basis. So principally, we've got 6 key aims to the program. The first, to try and embed operational research, OR, and data science methods within health, social care, and policing organisations, to try and increase the level of evidence-based decision making, developing skills. Obviously, that's a big part of what we do. You get 6 months of pretty intensive master's level training in some cases. It's quite advanced what you get, but we guide you through very gently. To create a collaborative community of embedded OR and data science ambassadors. Communities are a big part of what we do, and we'll talk more about the community aspect of the HSMA program later. Hand in hand with that, trying to develop and foster collaboration, not just between organisations, but even between sectors. So, we've had projects where people from health, social care, and policing organisations have all worked together. The HSMA program is designed to support things like that. And lastly, quite an important thing within our team is that we are an exclusively open science team. We believe that the work that we do, because it has an impact on people's lives, and therefore the work that we are teaching you to be able to do, modelling and data science to transform services, will impact real people. And therefore those real people have a right to know why things have changed and to have that transparency. And so we are an open science team. We only use free and open source approaches, and therefore we only teach free and open source approaches. And of course you have the advantage then also that there is no financial barrier whatsoever. You don't need to buy any expensive software. All of this stuff is free and open, and anybody can use it. That also extends to our training materials, by the way. We have a YouTube channel, GitHub. You can watch all of our stuff right now online. The team, just to say something about the team. So there's 4 of us within the HSMA team now. As for quite a few years, it was just me, but we've grown quite a lot, as you'll see in a moment. So I set the program up in 2016, and I've led that ever since. Sammi has joined us just last month, in fact, but has a lot of experience in both working in a mental health trust, having some teaching experience before. She's been on the MSc program that we run here as well, which has a lot of similarities to the HSMA course, a lot of crossover, and really brings that kind of frontline experience of exactly the kind of things that you are all doing and are interested in. Then we've got Amy, who's our administrator, and one of the key roles that she has within our team is basically tracking impact. We are fueled by impact. That's how we get funded. We have to show that we are making a difference in our research work, but also for HSMA in our teaching. That the fact that we are not only developing your skills, but then you are going on and doing cool stuff that makes a difference. And that absolutely happens in HSMA. And so Amy's the person that tracks all that. And then we've got Chrissy, who's our research manager, who's basically making sure that all the back end cogs are turning, and that we're continuing to exist. So as I say, we're the Pencore team within the PenArc, which sits within the University of Exeter, and the programme supported by the NHS Digital Academy. You previously knew them as Health Education England, so they provide us with the financial support for the programme, and also by the Southwest Academic Health Science Network, the HSN, although I think they've just changed their name, and also the Association of Professional Healthcare Analysts, which I expect many of you will be familiar with. They have accredited the HSMA program recently. In fact, we are the first ever training program to be accredited by AphA, which is quite exciting. So a bit of history. We started, as I say, in 2016. This is mainly to show you how far this has grown. So back in 2016, when we set this up, it was just for Southwest England, which is what PenArc is funded to support, because there's various ARCs around the country. And we had just 6 HSMAs, and we had it was just about discrete event simulation. We had 2 days of training. We all sat and had a nice meal, and we sit around every month and eat cake and talk about things, and it was very nice. But we identified that this thing had legs, and sure enough, when we then launched the kind of sequel 2 years later, we had a lot of interest. So we actually had 52 applications for the second round of the program. Again, it was still in Southwest England. By this point, we got up to 6 days of training. Then 2020 came along, as did another event that took over most of the world. And so we transitioned to an online delivery model. And we tried to see how we could make what we previously done in person work online. And we learned some stuff, and we managed to adapt. We piloted getting some police involved as well. We had a bit of funding to support that. And we basically doubled in size again, and the training started shooting up to about 17 days. So by now we're really starting to train in a lot of the stuff that we do within the team. And this was really successful. And the fact that this was successful, we managed to transition to an online model, got us thinking, well, we had a lot of interest from people outside of our region in going national, in providing the training outside of the Southwest. So now we've got an online model. Can we make that work? So we piloted it for HSMA 4. We actually had 300, over 300 people who expressed an interest in HSMA 4. Absolutely huge. We took on 80 HSMAs, and we've now got 23 days of training. And we then managed to secure some funding from what was Health Education England then, and to support basically the next 2 rounds of the programme. So HSMA 5, which launched the end of last year, we then went up to a 15-month structure. You probably, because it used to be a 12-month program, basically the day-a-week thing, there was so much training, we couldn't fit it all into 6 months. So we had to, into what used to be 3 months. So we extended the training to 6 months and made it a 15-month program, so that everybody could stay as a kind of day-a-week thing, because it was getting pretty intense in HSMA 4. Because we got up to 27 days of training by that point. We had 113 HSMAs, and this is our current cohort. And they are going to be presenting on that work at the Open Day, which we'll mention in a bit, where you can find out more about the next round of the program, which is HSMA 6, which is going to launch next April. And the applications are going to launch on the 13th of December this year at our Open Day, which we're going to talk about. So if you're interested in this program, there is going to be an opportunity to join it very, very soon. And basically, since this program has launched, we've worked with over 270 different HSMAs from over 80 different organisations across the country. Why do we do this? It's because of impact. It's the main reason I do this, and the main reason this is now my role, is because as an applied researcher, the thing that matters to me the most is getting that buzz from seeing the fun stuff that I'm doing in Python, that I enjoy, actually making a real difference to people's lives. And actually, in some cases, potentially even saving their lives when we're reducing waiting times for treatment. That's an amazing buzz. And the reason I do HSMA is to teach other people how to do this so that they get that same buzz. And Sammi is going to talk to you in a bit about some of the fantastic impact stories we've had from HSMA. But this is just a few glimpses of stuff over the years. A GP basically learning code for the first time and using it to support their COVID-19 vaccination program and transforming the way they do that. A multi-million-pound new mental health facility being built in Devon on the back of some work that was done in HSMA. Literally new buildings popping up. Reduced waiting times for patient-initiated follow-up in orthopedics. And the establishment of real modelling and data science teams cropping up in organizations that had previously never heard of operational research and only had a fleeting understanding of some of the data science stuff. So to talk a bit more about the training phase, so this is the first 6-month phase that you go through. Basically, you get a once a week, you come along to some live online training sessions. These aren't just, they go up on YouTube as recordings, but the real value is coming along to them and interacting and working on the exercises together, which is where you actually learn the stuff. And they're basically weekly sessions that run from 9:30 till 4:30, and they contain a mix of live lectures, so myself and Sammi who are talking to you, and then you go away in your groups to try that thing out, and then we come back and have a look at it, and then we teach you the next thing, and then you go off and you try that, as well as some sort of whole cohort interactive content. We play some games, and we try to make this stuff which is pretty intense. I mean, you go from learning the how to type, get the words hello world out on the screen in Python, to building a machine learning model within a matter of a couple months. So this is a pretty intense course, but we make that as fun and engaging and accessible as possible. Virtually all the approaches we teach are use Python. They're Python based. You don't need to know Python. You don't even need to have ever coded before, or maybe you just coded back in the distant past if you're old enough. You don't need to worry about that. We will teach you how to code from first principles, and then we'll show you how to code in Python. So it doesn't matter what your programming experience is, including if you have none, we will teach you that. And so hopefully that's a valuable skill for you, regardless of the rest of it. And it's split across 8 modules. Everything from intro to what OR is, what data science is, how to engage with these kinds of projects, and how to code, and how to code primarily in Python. And then all this other stuff, which is what we do in the team, modeling pathways and queuing problems using discrete event simulation, doing geographic modeling. Where do we place our services? What happens if we close these services? Machine learning, which is so big now. Can we teach machines to make predictions about stuff? Natural language processing, huge opportunities for this in a lot of healthcare applications. Can we extract information using AI-based techniques from free text data, of which there is an abundance? And we've had some fantastic natural language processing projects over the years. For those that don't know about natural language processing, I bet you've heard of ChatGPT. It's that stuff, basically. Modeling behavior and system dynamics, so agent-based simulation, system dynamics. So looking at modeling behaviors or the inherent dynamics within the way systems are structured. Open source collaborative development, which is basically where we teach you things like how to use version control, how to use GitHub, how to work together, ethical issues, how to develop web applications, which are actually really easy and so powerful. And what we're calling at the moment modern analytics and pathway analysis, which is basically a brand new module which we're bringing in that Sammy's going to be leading this year, which is basically all about being able to do some really cool stuff in your day job. Okay. So, as I mentioned before, the programme first ever accredited by the Association of Professional Healthcare Analysts, and it's also certified by Accredible. So, this is optional, but if you come on the course and then you want a nice certificate and digital badge and everything like that, then you can take a little optional assessment at the end of the training phase, and assuming you pass, you'll get a nice certificate as well for your career. Another thing to say about the training is that this is these are big cohorts that we're taking on, well over 100 people a year now. And so there are two of us, tutors, and we want to make sure that people are supported. So each of you, if you come on the program, you'll be allocated to a peer support group. It's a bit like a tutor group. And basically you will work in that peer support group throughout the training phase for all of the exercises and all of the training sessions. You'll spend at least half your time working with your peer support group, and that will be a mix of people across the program from different organizations, different sectors, different parts of the country. And you do all of these things together, you work together, and you support each other. And that's a really important part of what you do in the program. We also have some friendly competitions between the groups as well, which is always a bit of fun. So as well as the training that's offered in phase one, which is obviously compulsory, there are also optional sessions that we offer as well for those who want to access it. We offer revision sessions. So after every module, each of the eight modules is completed, there's an optional revision session. So if you thought, actually, I'm not sure that this is quite sunk in, I need a bit more support, or I need to ask some questions, then Sammi will be leading some revision sessions for each of the modules where you can go back over certain things, try out new exercises, new content, have a bit more of a practice, and we can support you with any questions you might have, stuff that you didn't really understand. Perhaps you thought, I didn't understand a word Dan said, but Sammy's explained it to me much more simply, and that's an opportunity for you to be able to do that. We also have project development clinics as well. So obviously throughout the training phase, you should be thinking about your inception project. How am I going to apply these skills? What project am I going to do that's going to then use these skills? And obviously part of that will be talking with your organization to find out what the problems are as you get exposed to the methods, seeing the sort of problems that you have that these methods might fit. But we'll have project development clinics, which are basically an opportunity for you to come along and say, I've got this idea, can you help me shape this? And we will support you to talk through those ideas and give you advice on how to try and make that a good a modelling or data science project. So that's phase one. Then you move into phase two, the inception project. And basically, this is the principal heart of the program, to be able to take the skills that you've learned and actually do something applied and impactful with them. And so the idea with this is that it's your inception project. The idea is that it's the first, hopefully, of many projects that you do throughout your careers. But for this inception project, you get a bit of extra support. It's structured. You get to present your work at the end of the program. You get lots of support from the HSMA community, and we support you to take those first steps to do your first modelling or data science project. But there is ongoing support, and we'll come back to that as well beyond that. So you basically, all HSMAs during phase one, you're supported to develop your project ideas as you're talking to your organizations, etc. as well. And as I said, the project development clinics will help you do that. And you can basically register any project on the program as long as it's an area covered by the HSMA program, obviously, because we need to be able to support you in the stuff that you're doing. It has to use free and open source approaches, which technically the first criterion should cover that, because we only teach free and open source approaches. So I'm afraid we won't support you if you want to do a project in Excel. And the application area has to be something in health, social care, or policing. But given the nature of the program and your roles, you should be able to tick those boxes very easily. Basically, once you register a project, it then goes on to a project register, which sounds very fancy and is in fact at the moment just a Google Docs spreadsheet. But the key point is that it allows people to see the kind of work that is being done. And you also get a channel on the HSMA Community Hub, which I'll talk about in a moment, which allows you to basically have your own space within the community where you can collaborate, you can work with other people on your projects, you can ask for help, you can ask for ideas, you can post updates about what you're doing, and it allows you that space to update and shout about what you're doing, and also just shout help. I don't know what I'm doing. Those things are equally valid. And the support that I keep mentioning is provided by our community. So you get supported on your projects by our community, primarily through myself and Sammi as the HSMA trainers, but also the wider members of the Pencourt team. We've got about 5 or 6 other members of the team who are obviously well versed in the stuff you're doing because they're doing this in their research work, as well as other members of the academic community who are working in modelling and data science, other practitioners, and HSMA alumni as well. So people that have been through the programme before. We've actually got at the moment over 300 people on the HSMA Community Hub. Throughout that project phase as well, you also have access to a monthly, what we call a monthly HSMA forum. These used to be called learning set meetings, but basically they're 2-hour meetings where you can come along and basically talk to people across the community and say, this is what I'm doing. Maybe just to, sort of share some cool stuff that you've done, or it might be because you need some advice and you want to, have a chat with some experts, or just, look to see if other people are interested in working with you on this. So it's basically up to you how you use these things, but it's a way for you to be able to update and seek help. So I keep mentioning the community hub. For those of you who are familiar, basically it's a Slack workspace that we use for the community hub, and that's the primary means of communication on the program. So once you join the program, everything's on Slack, and we've got dedicated channels for making sort of general announcements about the program, where you need to go to access your training materials for the upcoming training sessions, community chat. We've got a coding clinic as well, dedicated channel, which basically if you're stuck on some code, you can ask some coding questions. An impact studio where you can talk about impact your work has had. A channel for each project that's on the program, one for each peer support group as well, so you can work and chat just within your groups. And also a high score table for the HSMA game, which you will get to know if you come on the program. And basically it's a place to come together for the whole community to talk and ask questions and get support. And so we encourage everyone in the community to use this community hub as much as possible. Okay, I'm going to stop talking there and hand over to Sammi. Sammi, do you want to just sort of say next slide, please, and I'll keep sharing?
Yeah, happy to do that. Or I might, do you mind if I try taking control, if that works? Just because I've got a lot of clicking in my slides.
Yes, that's fine.
Work. Great, cool. I shall share my screen.
I can't seem to unshare. Where do I unshare?
Oh, we'll see if I can kick you out. Let's see.
Okay, let's try that because I can't
That
seem
work?
to.
Yeah,
hopefully. Oh, yeah, this is
coming through. Brilliant. Great. So yeah, thanks, Dan. Yeah, as Dan said, I'm going to talk a little bit about the impact that some of our projects have had, and as you pointed out, all of this comes down to, it's great teaching you things, but if you can't actually then go ahead and use it for your organizations to make to make an impact on the problems that they're having and to improve the lives of patients and staff, then what's the point of it all? Thankfully, we've had some fantastic HSMAs over the years who've had those brilliant impacts, and I feel very privileged to be able to tell you about all these incredible things they've done. So I'm just going to go through a couple of different projects. I'm going to start off with a lovely collaboration between NHS England Specialised Commissioning and a couple of people from the strategy unit. So this was about reducing travel times to treatment for the cardiac patients in the southeast of England. So what they wanted to do, we used some of the geographical and statistical analysis techniques that they'd learned on the course to look at the past and present travel times and understand the impact this was having on patients travelling into London for their cardiac treatment. So actually changing the referral pathways, minimise the amount of travel that was happening, and actually what would happen if you put in additional sites rather than building these sites and then going, oh, actually there was that hasn't really helped. Let's work this out in advance. So the output of this, the team managed to create a Streamlit application. So this is a web application, a bit like Shiny for any of you that have used that, or Plotly Dash, but we focus on Streamlit within HSMA because actually we find that's a really great way to get a web app up and running really quickly. And this streamlet allowed users to see current travel times for people across the whole catchment area of the service. So we've got a lovely map here. We've got the longer travel times over on this right-hand edge, and you can see the existing 2 sites outside of the actual catchment area for the people we were interested in. And then the user could input a list of possible new sites and see the impact of what would happen. And it would even then tell you what the optimal configuration would be given the different sites that you'd been able to put in. So the South East Cardiac Network reviewed the findings, and all of this work is now going in as part of the evidence base for service planning, being combined with other bits of evidence. The other great thing about this is there's interest in applying these methods and tools to other services. Once you've done it once, this is such a reusable method, such a reusable web app. It's got great potential to be shared, and as Dan said, we have a real big focus on open source and sharing of code and tools. Next one I want to talk about is discrete event simulation for improving flow and performance in an urgent treatment centre. So obviously this is a very big one in the news all the time. It feels like over the past few years. And this person created a model, a discrete event simulation model, to deal with the allocation of staff and rooms to match patient flow. So they wanted to be able to explore whether changing the number of staff available and the number of resources in terms of the rooms available would be helping as patient attendance varied, and actually would changing the way the patient pathway was structured reduce bottlenecks. So actually, if we move the diagnostics to the beginning of the process, what would happen? And the great thing about these operational research techniques is it allows you to do this in a very risk-free and cheap way, because obviously moving that to the beginning is going to be a huge problem if it turns out it doesn't work. So the discrete event simulation showed how the patients flow through the urgent care treatment centre. This isn't the exact model, but actually what it does show you is what a discrete event simulation can do for you. It can show you where those queues are building up, how much resources are being used at a different time, and the resources being utilised an effective amount to make them cost effective, and where are the queues building up to a dangerous level. After the initial model had been developed, it was used to test the impact of those proposed alternative pathways and the different numbers of staff and different rooms. And as I say, this kind of model makes it really easy for your stakeholders to understand the impact of changes to existing provision. And actually, this went on to be used. The Deputy Divisional Manager of Emergency Services gave us a lovely quote that since increasing the number of rooms available to the urgent care treatment centre, directly suggested by the demand and capacity modelling, there was an increase in performance, better care for patients, better working environment for staff. What more can you want? But discrete event simulation doesn't just work for these kind of pathways where you've got lots of people moving in and out very quickly. It can also work really well for these sort of larger scale services over a longer period of time. So for anyone who's either working in mental health or has friends and family waiting for autism and ADHD assessments at the moment, you might be aware that the waits are huge and the demand is just growing and growing. So this project wanted to understand the current pathway to identify any bottlenecks, and the suspicion among the staff in the service was that actually that bottleneck was near the beginning of the pathway, and it was to do with getting questionnaires back. The wait needed to stop growing and the backlog needed to be dealt with, but was this actually where the problem was? Again, another Streamlit app, very popular among the course, and we're only focusing on this more and more next year to make sure that people can create the best Streamlit apps they can. So this app simulated patient pathways with different numbers of clinicians, and this could show the impact of additional staffing on this existing backlog, and tell you how many staff, if you had 3 extra clinicians, 4 extra clinicians, how long would it take you to clear that backlog? And actually, it turned out the issue wasn't at the beginning of the pathway. It was actually further down the pathway. It was clinical staffing capacity. And the developed model showed that just one extra lower cost, easier to recruit clinician would have a steady state and the backlog no longer growing. It was a massive finding. Now moving on, so we've got a wonderful topic from Matthews, who I've noticed is on the call today, and a couple of his colleagues. Well, not even his colleagues. This is a lovely one where we've got collaboration across a range of different organisations. So this was to do with developing a service planning decision support tool for tackling inequalities and minimising carbon output. And so this wanted to look at what happens if you add a new clinic location, what does it do for inequalities and carbon emissions, and actually what are the trade-offs between the two of these things. The team achieved a lot in the short space of time. So they automated the health equity assessments, and this looks at the profile of patients currently using the service compared to the population at large, and actually what's the mismatch between those two and what you might expect to be seeing. They also use machine learning to identify the features that will predict whether someone is going to not attend their appointment. And they quantified an estimate for the patient travel carbon emissions for the current service design. Now, the big impact here, as far as I'm concerned, is not just that they managed to do these incredible things, but that they made it possible for these equity analyses to happen at all. So this made the existing process around about 80 times faster, which is great. What this means is for one service, you're moving from 2 full days to 15 minutes. You've got 35 services where Matt was working. Realistically, with that taking about 12.5 weeks of man hours, that's not gonna happen. There was just not enough time for that kind of work to happen. So actually, you scale this to whole ICS, you're looking at under 21 hours versus 48.5 weeks to work on that level of that level of granularity. It's game changing, and that's the kind of thing that actually you can take away and apply to all of your reports, everything you're working on in your day-to-day job. And actually, the other thing is that they were successful in securing a funding from the Greener NHS Healthier Futures Action Fund. Bit of a mouthful, that one. But this is something that we see in other projects as well. That your project doesn't end necessarily when your 9 months is up. You might get funding to continue it further. You might publish. We have had people who have become published in scientific journals, and we will help you to do that if your project is something that is publication worthy, and often they are. And finally, I'm going to talk a little bit about the COVID-19 pandemic model that Dan mentioned. So yeah, we can all remember winter 2020. It feels like 5 minutes ago and also a lifetime ago. The vaccinations had just been approved. The mass vaccination programme was required, and local GP surgeries, as well as the mass vaccination centres, were part of this. And it was something that had never been done before. The scale was just, we didn't really have any prior data to work with. So the project wanted to make sure that the plans were safe and efficient. So Adam created a discrete event simulation model of the proposed pathway for North Devon, and the model was able to predict how fast you could vaccinate people with the proposed resourcing, but also what was were there risks of social distancing breaches, whether that was in the waiting room, in the car park, at different points in the process, making sure that those queues weren't going to build up to a dangerous level at any point through the pathway. And actually, the model identified potential issues, and it was then used to refine the plans to make sure that the delivery was both safe and efficient. And Adam said that the knowledge from the HSMA course, being able to use that to help design the process, was fantastic, and it helped the clinic to deliver over 100,000 vaccines. He then also went on to work with the Southwest Academic Health Science Network to develop a generic version of this model, which can now be used for any future vaccination services. Fingers crossed we won't need them, but the model is available free and open source for anyone, anywhere in the world. And he'd never coded before joining HSMA. And there's so many more that I don't have time to go through in detail. Just a handful of them. We've been predicting admission, our HSMAs have been predicting admission risk from free text notes, reducing delays in cancer pathways, forecasting paediatric length of stay, using sentiment analysis to monitor the tweets to police forces. What are people talking about? What are they concerned about? Exploring potential impacts of patient-initiated follow-up, modelling mental health demand, exploring the impact of booked appointments on waiting times. The list goes on, and the skills you develop are so flexible to be able to tackle those things that really matter to your organisation. So I'm going to move on to talking about the open day now. Dan, do you want to take back over, or do you want me to do the next sliding?
You can do next slide if you like, just to make it easier. So next slide, please. So the key thing, really, if there's no more important slide perhaps than this one, if you've listened to what we've said and you think this sounds like something I'd be interested in, come along to our open day on the 13th of December. You can see the link there. Perhaps if somebody that's got access to the chat can pop it in there as well. Sign up for the open day, 13th of December. It's a long day, so it runs from 9 to 4:30. You may not be able to stay for all of it. That's okay. You can. There's a full version of the itinerary that you can view. Basically, that day we'll start with a talk from myself, which is kind of an expanded version of what we've done this morning, with a bit more detail about the application process, because the applications will open on the same day as well. But actually, most of the day is going to be hearing from our current cohort, our HSMA 5 cohort, presenting their work, talking about the projects that they've done and what their next steps are and their HSMA journeys, interspersed with some workshops that we've got as well, interactive workshops, which are basically little mini HSMA taster sessions. So I'll be running one that if you've never coded before, I'll get you to code something. In fact, you'll get to create a little word cloud in Python, having never used Python before, all within an hour. Sammy's going to take you through some fantastic discrete event simulation stuff, the sort of thing you were seeing a moment ago, and being able to see how those models work, and to play around with those models and see the potential for that. We've got some great stuff lined up in that workshop. So if you are interested, please do come along to that, or at least some of it, and sign up there. We've got well over 200 people already signed up for that, because it really is. I think the most important thing I can say to you is that there's often a misconception with this kind of stuff, that people think, oh, I can't do that. That's not for me. You know, being able to do Python code, you know, I wouldn't be able to do that. Do you know what? If you're interested in it, you can do it, and we will support you as much as we can to do it. The course is designed to be accessible. This sort of stuff isn't just for the elite academics that we sit in our ivory towers and say, look at all this amazing magic stuff that we can do and you can't. That's not what this is about. You can do this stuff too, and we will support you to be able to do that, and we will do that in as fun and engaging way as possible. But don't doubt yourself. You can do this, so don't be put off thinking that you can't. If this is of interest to you and you think, actually, I'd find this really interesting, you're probably right for HSMA. Okay, so do come along to our open day if you can. Next slide, please, Sammy. So just to say, this is just a little bit of a glimpse of some of the things that you'll get to play around with in the workshop. So this is Sammy's little workshop on discrete event simulation. You'll get a little playground of a model, a discrete event model. And you'll see the steps of which these things are built. The idea, you're not going to learn how to code it in an hour, but what it will show you is, do you know what? All of this stuff, there's not that much code to it. And once you learn it, SymPy, the thing we use for this, it's a bit weird, okay? But once you learn why it's weird and you get used to building a little model, you just build a big model by doing lots more of that weirdness. And you'll find that out in the course. Actually, it's quite straightforward once you know how to do it. Next slide, please, Sammy. Oh, that's the same thing. Yeah, go on to the next one. So yeah, so Sammy's also going to be taking through a introduction to QGIS. So you heard some fantastic examples from Sammy there about some of the geographic modeling work. You'll get to play around with QGIS, which some of you may have used ArcGIS before, which is a commercial package. We use something called QGIS in the team, which is basically a free and open source equivalent. And in that workshop, you'll get to create a little map. And again, nice little taster of the sort of thing that you'll be able to do within the HSMA program. So last thing to say, how do you apply? Say the open day, hopefully you can come along to that on the 13th of December. That's when the applications will open. The applications will then close on the 4th of March 2024, and you will all be notified by the 18th of March whether you're successful or not. And then if you are successful, and I hope you are, the program will then begin on the 16th of April next year. If you can't make it to the open day, but you do still want to apply, then make sure to sign up to our mailing list. If you just email pencord@exeter.ac.uk, just ask to be added to the mailing list. The mailing list is only used for HSMA, basically, and so you'll just get notified about HSMA is launching, and there's a little newsletter about HSMA stuff. So if you want to find out more about that, join our mailing list. You will then get automatically sent the application pack for the program. And then the last slide, just to say, if you want to find out a bit more information, there's some extra resources here. We have our resource site here, which has a lot more information about the program and about various news stories. You can read a bit more in depth about some of the stuff that Sammy was talking about. We've got our YouTube channel, which has got nearly 1,300 subscribers now. Goodness knows how. They are basically just raw recording dumps of me talking for 6 hours. Apparently that's quite popular. Who knew? We're going to look to do some proper YouTube stuff, but at the moment we have this YouTube channel. You can literally sit there and watch the lectures from previous years if you so wish. It's all open, and each of those videos will link to the training materials, so you can follow along with the slides and do the exercises if you so wish. We obviously make that free and open to anyone anywhere in the world, and people do that, and it's fantastic. But obviously the real value of the program is coming on the course, getting to work on this stuff live with your groups, and then of course applying this stuff with support from the HSMA community. And Matt, who I know is here, fantastic example of that ongoing community model of HSMA. Matt joined us for HSMA 4 and has been going on to do much more fantastic work. Matt's going to be speaking at the open day as well, talking about all the great stuff that he's done since, and is still very much part of the community. So this isn't 15 months and then we wave you goodbye. You're in it for life if you want to be. Okay, so you get not just access to a free training course that offers university level education, but you get a permanent access to a community. So if you ever want to do any modelling or data science projects, you have access to hundreds of your peers and experts who can advise and guide you. Okay, I'm going to stop talking there. Apologies, we probably overran slightly. I don't know if there's time for any questions. I know we're probably a bit limited, but thank you.
Well, just want to say thank you so much for talking about the training program, Dan and Sammi. I really enjoyed that, and once again, I get so excited and I'm so enthusiastic about the program, and I'm so pleased we're able to sort of raise awareness of it, I guess, here in the Midlands. And I know we've sent some people, including Matt and Victor as well, was there last time, I think, and others. So pleased to be able to share this with people in the Huddle and to the analyst network beyond the Huddle as well. We'll be doing that. So yeah, so thanks again for that. And each time you talk about it, I just think everything about it is amazing, and I want to do it every single time you do this. I just think I want to do it, and so maybe I'll just push all these others out of the way and sort of get right up there, and get myself at the front of the queue. So there are quite a few questions, and no, we don't have time to go through them, so I'm going to pick just one or two. And then if it's okay with you, if I share them with you afterwards,
Yes,
then you go at your leisure. You can provide some responses. So one of them is, so you've talked about how popular the course is, and quite rightly. So obviously not everybody who applies can go on this course. So somebody's asking about what those criteria are to determine eligibility is one, and also what would make you more chosen. That isn't their words. I should have just used their words than others.
Yeah, no, that's a good question. So we'll go through this a bit more detail on the open day, but basically the central thing we're looking for, two things really. First of all, are you genuinely interested in not only engaging with this kind of stuff, but actually using it? Okay, is that you're not just sort of coming on the course because it's a box you can tick on your development training. That's not what this course is. It's
Sure.
you have to have genuine enthusiasm for it, and something that would sort of indicate you'll probably be all right and with this kind of stuff. So you don't need to code it before, but you know your way around a computer because you're about to be taught Python. But the other key thing is that your organization kind of really supports this. They're on board with it, because what you don't want is just to come on this course and then find you can't actually do anything with it because your organization is not really interested. You need your organization to be engaged and saying, yeah, we want to send you on this because we want to build up our capacity to be able to do this kind of stuff. So you go on that course and then you can work on these projects. That's what we're looking for. So people that are both people and their organizations who are genuinely engaged and have a plan to kind of use this stuff. By far, that's the most important thing we're looking for.
Absolutely. I couldn't agree more with that, because if you don't have the support of your organisation, your line manager, your team, whatever, like to learn and apply what you're learning to, and so especially to a project which is or questions that they strategic questions that they want answers to, and so that they're engaged and part of that process as well. So important. Totally agree. And I've run out of time, which is absolutely fine. And so I would. There's just something in the chat, so I'm just. Oh, so Matt's popped something in the chat. So Matt he's presented at a Huddle, and he's going to be presenting again. He doesn't know that yet. I just like to throw these things in. He keeps promoting it locally, as it's fantastic. There you go. That's what we like to see, isn't it? Can you actually see the chat, Dan?
No, unfortunately, no.
Yeah. So I could say oh, that Matt says it's rubbish. No, he doesn't really. He's wonderful. He's been promoting locally. Yeah, so huge fan there, and obviously he got a lot out of it, and continues to as well, reap the benefits. So I would just finish by saying thank you so much again, Dan and Sammi. Great to see you. Good luck with the current cohort and all of the previous ones, and what an amazing thing you're doing there. And hopefully we'll see you again.
Thank you very much. Thanks for inviting us.
Thanks for coming, everyone. Pleasure.
Thanks, everyone.
And we'll see you all in a couple of weeks.